mapping part of the research component. I wanted to put that off a little bit to another time, perhaps next time, just so that we could try to cover as much of the sensory and motor functioning as possible. So just to finish up the research section, I just had a couple of things that I think will be important. If you could maybe turn off the front light. Yeah, that's great. Thank you. I wanted to introduce this idea of Brodmann areas. And the Brodmann areas were identified by a scientist named Corbinian Brodmann, who in the late 19th century used a particular stain to stain cells in the cerebral cortex. And he found that certain cells in certain areas stained in a similar pattern. And so, as it turns out, these groups or areas have come to be known as Brodmann areas. And we use these as anatomical landmarks, especially in functional imaging, to identify areas of the brain that become active. And so you'll note that, for example, Brodmann area corresponds, the Brodmann area 44 corresponds to Broca's area. We have this primary motor cortex, or the precentral gyrus, is Brodmann area 4. So that's the primary motor strip. And just behind that, this is the central sulcus here, or the fissure of Rolando. And here is the primary somatosensory cortex, or the post-central gyrus. This corresponds to Brodmann areas 1, 2, and 3. They're all kind of mixed together. Then Brodmann area 6 is what is known as premotor cortex, and that's just adjacent to the primary motor cortex, which if parts of the primary motor cortex are stimulated, you'll have some movement that happens. Again, most functional neuroimaging studies will report activation or increased activity, blood flow, metabolism in these particular Brodmann areas. This is the medial surface of the brain, and you can see there are some other Brodmann areas that are identified. So when I refer to Brodmann areas later on today, I'm referring to this nomenclature and this pattern of identification of brain regions. So in addition to identifying specific gyri and sulci, we also have the Brodmann area way of identifying neuroanatomy in the brain. So this is much too small for you to read from where you are, so I apologize for that, but these are, this is a list of some of the Brodmann areas and their functions, and the corresponding location in terms of what gyrus corresponds to a particular Brodmann area. And so if you're looking through Echo 360, you can look at this a little bit more at your leisure. It's relatively readable on my screen here, so you should be able to read it, hopefully. And if not, just let me know and I can provide a handout that shows it more clearly. One other thing I wanted to just address is a behavioral strategy that is often used for brain mapping. And when we do functional imaging, we want to look at, for example, the changes in blood flow in a particular region that correspond with cognitive activity. Or we might want to look at changes in metabolism of glucose that correspond with a particular cognitive activity. And so it's tempting to just put the person in the scanner and say, okay, here, remember these words, and then you take the image, and then you're tempted to say, well, when somebody's learning a list of words, all of these areas of the brain are active. And so some of those areas aren't related to memory at all. A lot of those areas of the brain would be related to hearing the words or seeing the words, kind of more the sensory input, and some of it might be related to motor output and not specifically to memory specifically. So this strategy is used in most functional brain mapping techniques where you're trying to look at what brain areas are associated with a particular cognitive ability. And so we use this subtraction technique that was introduced by Donders way back in 1868. Before there was even functional brain imaging around, Donders came up with this idea of performing a control task that has the same sensory input and the same motor output as the task of interest. And you contrast that image taken during the control task with the image obtained when the person is actually doing a memory task or an attention task or whatever cognitive ability you're trying to evaluate. And so here are a couple of examples where a control task might be eyes closed, and the active task would be eyes open. And so you take a brain image of the person with their eyes open. They're sitting there just looking with eyes open, looking straight up. And then you take another image after that one with the person's eyes closed, and you subtract those two images. And the difference between those two images, what's left over then, is represents the cognitive ability that you're trying to get at. Here's another one, viewing nouns versus eyes open. So just having your eyes open, not reading any words, versus having your eyes open and viewing nouns. That's again, that's a little bit more complex task. So we're subtracting out the simpler task that has the same visual input and or motor output as the task of interest. Here's reading nouns aloud versus viewing nouns, and generating verb versus viewing nouns. And this is actually a study that was published by Steve Peterson years and years ago, back in the mid-90s. And he was using positron emission tomography that I talked about a little bit last time. But in each case where each of these comparisons is a hierarchical increase over the previous one, and it's trying to get at looking at how we process language in the brain. And so this is again kind of the basic idea of cognitive subtraction. If this is the activation that we see while somebody's doing a task, like say viewing nouns, and this is the image that is obtained when the person is just having their eyes open and looking straight up, we subtract this image from this image, and the difference is here. This is the area that would seem to be associated with reading or viewing nouns. Does that make sense? Okay. And then this is the whole study that I was talking about as published in the article, and this is reflecting difference images at different levels or different cuts. These are axial images of the brain. Now remember, I want you to be familiar with the terms axial, sagittal, and coronal cuts, because I'll have maybe an axial, sagittal, or coronal cut on the exam, and I'll ask you what cut is this. So these are axial cuts, and this is just showing at different levels, going from closer to the top of the brain, kind of a little bit lower yet, and down through the kind of the brain stem and cerebellum. And just showing you the difference image, viewing nouns, for example, minus eyes open, shows a significant area of activity in the occipital and parietal cortex, as you might expect. Also on the left side and the left, what would seem to be about Broca's area, even though it's just silent reading, Broca's area still tends to activate when we do silent reading. Kind of interesting. And this is a little bit more what we might see associated with various tasks, language-oriented tasks, especially reading, involve a lot of occipital activity and a lot of frontal activity, some left temporal activity. This is kind of a resting state In the resting state, we don't really know what people are doing cognitively, because people oftentimes when we have people rest silently, they're sitting there thinking what they're going to do after they get out of the scanner, maybe planning what they're going to have for dinner, trying to remember if they had forgotten anything before they came over. Did I miss an appointment? So a lot of different areas could be active during rest. So rest isn't really rest. And somebody cleverly came up with the idea that rest represents random episodic silent thought, R-E-S-T. And that's about right. So when somebody's just in a resting state, that's not a great control task because of so many different things that could be going on in that person's mind. So the control tasks are really, the best control tasks are those where somebody is actually having to do a specific task of lesser cognitive complexity than the task that you're interested in imaging. So that's a little bit about the subtraction technique in functional imaging. We use this again with positron emission tomography, or PET, and functional magnetic resonance imaging, or fMRI. All right, any questions about that before we go on? All right, I wanted to start off with talking about the organization of sensory